Okay, so for sealants, your patient comes in, we're gonna have our prescription that has the teeth that we're gonna put the sealant on. So the first thing we're gonna do is we're gonna examine the teeth. So we have an assistant, we're gonna examine the teeth. So we're gonna kind of check those grooves, make sure everything's good. All right, good. Okay, so after we examine all the teeth that we're gonna do, then we're gonna take a toothbrush and we're gonna clean the teeth, okay? So in the beginning, we're gonna clean all the teeth that we're gonna seal. And you really wanna get in there and kind of make sure there's no food or anything stuck in there. We'll clean all the areas. And this is a dry toothbrush with no toothpaste on it. We don't want toothpaste because the fluoride in the toothpaste can interfere with our sealant. Okay, good. And now we're gonna rinse. So our assistant will use her saliva ejector and we're just gonna rinse. Okay. I'm gonna rinse really good. All right, good. And then we wanna dry. So if your patient's sensitive to cold, then we can use a 2x2 to dry it. My assistant's gonna get all of that water out of there. We're gonna dry, okay? I'm gonna keep my finger in there so they stay open, and now we're gonna articulate. And the articulation is gonna show you where the patient occludes, so you know where not to put the sealant. So have your patient bite down, grind around, and then the assistant's gonna get the Mr. Thirsty ready because that's where the bite block is. So after we articulate, we don't want the patient to bite down again because we'll lose our marks. So we're gonna come out, get rid of the articulation paper. Patient's gonna stay open. All right, stay open for me there, sir. And now we're gonna put in the Mr. Thirsty. It's gonna go right inside there. On Dexter, we have to push it way back in there, but on your patient, you're not gonna put it back that far. Okay, Mr. Thirsty goes in, good, and we'll flip that on, please. Perfect. Okay, so now I'm gonna take a look, and I wanna just take a look and make sure that we got those good marks on there. Perfect. Now we're gonna put a dry aid in the cheek. So the triangle's gonna go in the mouth, up here on the cheek, because that's where our Stenson duct is if we're doing this number 3 here, okay? That goes in. All right, so now we're gonna etch, okay? We're ready to go. The area is isolated. Stay biting on that there, sir. There we go. Okay, when you get your etch, you're gonna dispense a little bit out on the 2x2. Indirect vision, we're gonna come in. I'm gonna stay out of the way here. So we're gonna etch. I'm not using indirect vision so you guys can see in the video. Okay, we etch, give it right back to our assistant on the 2x2. We don't wanna get etch on your gloves because remember that's phosphoric acid, so we wanna be careful with that. And the etch is gonna stay on for 15 to 20 seconds. And then just water. And the etch will come off easier on your patient than it does on here. Good, our assistant is nice. She's gonna stay in there with the suction.
The dry aid has some mess.
Huh?
The dry aid has some mess. That's under your mirror.
Oh, okay. There we go. All right, so once I blow air, then she's gonna come out with the suction and she's gonna get ready for the sealant. All right, so sealant, we're going to dispense some out to make sure that it's all mixing correctly. And then we're gonna dispense our ball. Grab it like a pen. We're gonna fulcrum, and then we're gonna drop on the mesial. And we're gonna drag. Can you see if I do it? Oh, just stay back here. But we would be doing indirect vision, remember? Indirect vision. So you're dragging. And you can do the mesial first and then come back and do the distal. I'm gonna do both. So I'm gonna come out, another bubble. Now I'm gonna go for that distal lingual groove. Drag it over. And I also have the cusp of Carabelli right here. I could put a little bit. And then my assistant's gonna be ready with the micro brush so I can get out any of this excess. I'm gonna give that back to her, take my micro brush, and then we're gonna get ready to cure. So when you're dabbing, you wanna make sure that you just dab into the sealant material. Don't push way on the tooth like that because you're gonna take it all out. So we're just gonna dab, and then we're gonna cure. Okay? So we'll cure. Beep, beep. Okay. And now we're gonna check with the Explorer. So when you check with the Explorer, you wanna make sure that it's nice and smooth, that there's no catches, there's no voids, no bubbles, and it should just slide, kind of like a nice ice skating rink. So now if something like this happens, if you can see where my sealant is coming out, that means that we didn't cure long enough, or we had moisture that came in. So if that happens, it's fine. We can go back and add more sealant. So you can always add more, okay? So at that point, depending on why this came out, we would want to re-etch for 5 seconds and then apply the sealant, okay? So you would do the top tooth and then do the bottom teeth down on the bottom. So let's talk about that a little bit. When you're gonna redo the mandibular teeth, we're gonna have our patient sit up just a little bit, and then we're gonna do our mandibular teeth. The good thing about the Mr. Thirsty is he's blocking the tongue. The only thing you might wanna do when you're doing mandibular is put a cotton roll here. So we'll show you what that looks like. So a cotton roll would just go here, just to keep the moisture down. So once we finish all the teeth on that side, then we're going to take a wet cotton roll. So the wet cotton roll is to remove the inhibition layer. What happens is sealant and composite, when it cures, the very top layer of the material does not cure. So it has a really, really bad taste. So you want to wipe off all those teeth that you cured. And then we'll remove our isolation. The cotton pliers, please. Get this out of there. Yes. And then we'll go ahead and take Mr. Thirsty out. Go ahead and open for me, sir. There we go. Give the patient a break for a minute. Okay. And now we're going to floss in the area that we did, because we want to make sure that we don't have any sealant on the inner proximal of those teeth. So we're going to floss. Good. Good. Now, what if you have sealant that kind of rolled in that inner proximal and you can't get it out? You'll have to use a floss threader and go through and pull down on that sealant. So that's an option as well. All right, so now we'll take a 2x2 and we're going to dry and re-articulate. Going to dry, and then I'm going to bite down for me, tap, 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 and then I'm going to take a look with my mouth mirror to see if anything is hitting. Stay open for me. So at this point, you're going to look and make sure that there's no sealant where the patient bites down. If there is sealant, then we're going to have to adjust that, and we can do that with a carver, like a discoid cleoid carver or something to do that. But you want to check each side that you do, so you can make sure if this side is high, we want to get this side in occlusion before we move on to the other side. Okay, so the only post-op instructions we would give our patient is to not chew on ice. The problem with ice is that when they chew on ice, it freezes the sealant, and the sealant will shatter out of the tooth. But that's sealant for you.